Hi, my name is Rahul Patwari. I'm the Associate Dean for Curriculum, and I wanted to take this opportunity to explain how our curriculum works in the video that follows. And so you can see in this picture, this is our large classroom in which your entire class gathers to go through all the cases you will have in your first 2 years. We're going to discuss this in a little bit more detail in just a second. Let's start first with an overview. And our mission and vision are listed here, and I'll let you read those on your own. But our goal really is to create in you competent physicians that can function in many different avenues, in practice, in education, research, and service. So we want to prepare you for the clinical environment so that by the time you get to the clerkships, you have all the skills that you need in order to function well there. We want to prepare you for the practice of medicine, not just to do well on your licensing exam, that is the USMLE Step 1 and 2. We want you to do well on those tests, but we want you to have all the skills you need, the other skills you need in order to practice medicine well. We achieve this through a one-pass curriculum. That means that we're going to teach you everything about the heart at one time, all the normal stuff and the abnormal stuff. This differs from other curricula where in 1 year you learn the normal heart and the next year you learn the abnormal heart. We put them together so that we can hopefully achieve some synergies by teaching you it all together. And we want to try to create an engaging experience for you. We don't want you to just sit and lecture, passively absorbing information, but we want you to interact with one another, solving problems, real patient care problems. This slide shows you all 4 of our years. You can see that we have courses going through the first year and the second year. And you can see that they tend to focus around organ systems, so cardiovascular and renal in the vital fluids block, gastrointestinal in the food to fuel block. So in this block, you would learn all the normal anatomy, physiology of the GI system, as well as all the things that could go wrong and what to do about it, the diseased states of the GI system. And that happens throughout the second year as well, and it finally culminates in this consolidated cases block. Here, you're going to have patient cases that are affecting multiple systems. So a patient may have a cardiovascular, pulmonary, and neurologic problem, and you need to be able to take care of that patient. Finally, at the end of that year, you prepare for and take step 1. Then you start your clerkships, and you can see here blocked into 3 groups: medicine, neuro, and psych in one, pediatric primary care and an elective in the next, surgery and OB-GYN and an elective in that last one. And then you go enter your 4th year, during which time you have electives and interviews, and finally, graduation. Let's talk about collaborative learning in our curriculum. So here's a picture, again, of our new collaborative space, and you can see here that we have students sitting around a table discussing answers to problems that are in front of them. And here we have a clinician educator who goes around and facilitates discussion. Wandering through the room as well are basic scientists that are PhDs who could come by and answer questions. All the clinician educators are practicing physicians, so you're going to be taught by practicing doctors. And so every case, every session is centered around a hypothetical patient case. So in this case, we have one of a gentleman whose chest hurts. A team of 6 students now will work together to solve problems related to that patient's case. And then we have 3 of those 6-person teams, all in one group, and they're paired with 1 clinician educator. And the clinician educator has some technology there as well to support them. The entire class is made up of 8 of these groups. So you can see we have now 8 groups here, each one with their own clinician educator. And then we have the rotating basic scientists who will go from group to group to group answering questions. So this person may be an anatomist and can answer anatomy questions. This person may be a biochemist and answer biochemistry questions, circulating through the room. These are the 2 rooms that we have. This room on the 5th floor will fit an entire class, and so we will have all 8 groups in there at one time. And you can see here is a TV screen with the technology. Here's a table that seats 6. Here's another table that seats 6. And we have these dry erase boards scattered throughout to act as dividers and to write on. There's another room on the 4th floor, which is about half the size. It'll fit half the class, and we will be using that from time to time as well, and you can again see some of that technology there. Students have the ability to cast their laptops, iPads, etc. to these screens so that they can show them to the rest of their group as well. And so here again is a picture of one of these sessions going, and here's Dr. Levin, one of our assistant deans, helping some students through a particular case. Let's talk about what it means to be one pass and integrated. So this is what our courses look like in the first year, and let's look at one course in general, in particular, vital fluids. And within the vital fluids course, there are going to be several cases. And remember, this was the cardiac and renal block. And so we have somebody having a heart attack here, somebody having heart failure, another one with new onset kidney failure, and here's one of a long-standing kidney failure patient. So every week we may have one or two of these cases. So let's take a look at what would go on in this myocardial infarction or heart attack case. And so in this case, students will prepare by learning a lot of normal stuff and some abnormal stuff, as well as some things pertaining to those roles that we discussed before. So in this example, maybe we learn the coronary artery anatomy. We learn the heart as a pump from physiology. We learn how to read an EKG or electrocardiogram from pathophysiology. We learn about the pharmacologic treatments from pharm, and how to make a differential diagnosis, that is clinical reasoning, from the practitioner role, as well as how to maneuver the insurance system from advocate. And so all of these things are put together into that one case. So that's what we mean by vertically integrated. We have put the normal and the abnormal together, and we're going to go through it all together in one time. There are also some sessions that focus solely on the roles. For example, ethics could be one, educator might be another, and they function very similarly. Now all of our classes are administered using the flipped classroom approach, so let's take a little bit of a look at that. In a flipped classroom, what students will prepare at home by reading some materials and watching videos, and then come to class and solve real-world problems. So you can see in this video, this is Dr. Shannon, one of our physiologists, is discussing vascular smooth muscle. And then in class, it looks like in this one, students are going to be reading EKGs, and so they will have had some preparatory material on how to read an EKG, and then they will try to read them. Now their clinician educators will help with that, as well as the rotating basic scientists. And you will work in small teams of 6, and they all report the results together in the larger group of 18 students. So here's an example. You'll be given a PDF of a self-study guide that has a number of topics in it, a number of pages, and you would read that beforehand, as well as watching the video in order to prepare for the case. There are also practice questions in this study guide. When you get to class, then, it's time to start doing some activities, and so you'll get a case and then some questions about the case and filling out these tables and identifying structures on diagrams, as well as answering USMLE type questions. And you will work together in your teams of 6 as well as your groups of 18 in order to complete that. And you will have the help of a clinician educator, as pictured here, who will help facilitate that. During the first 2 years, there are some other supplementary programs we should discuss. The first are 2 programs we have. One is the Family Medicine Leadership Program. This takes about 5 students a year, those students who have a particular interest in family medicine, and embeds them in various clinical environments and scenarios that emphasize family medicine, the practice of family medicine. The Health Equity Program takes about 20 students per year, and similarly, it will embed students in scenarios and didactics that helps them learn about the equitable health care distribution. There are several electives that you can take if you choose to, and they're listed here: medical Spanish, humanities and medicine, medical genetics, and biomedical research. And finally, let's talk about the Explore program. This is a program where students have the ability to work one-on-one with a physician in various different aspects of their career. It might be working with someone in a clinic, working with someone in an operating room, an emergency department, in their research, working on other programs and projects as well. And the goal is that they're able to explore the different avenues and the different areas that physicians work in. Now let's talk about step 1 preparation. And step 1 is one of 3 parts of an exam you need to take in order to get licensed. And step 1 is a pretty important exam, but we like to stress that it's not really a test of intelligence, but rather an exercise in time management, discipline, consistency, organization, and maintaining your wellness. We want to prepare you to do well on this exam, and we're going to do that over the course of the next 2 years. We know that a lot of emphasis is placed on this exam, and we want you to have the confidence that you will do well. And our students in the past several years have done really well on this exam. We provide help for everyone, and we also do several practice tests to give us the analytics we need to identify students' areas that they need to work in so that we can give them targeted help as well. Let's now talk about the clerkship curriculum. And so the clerkship curriculum is when you actually get to go into the hospital and take care of real patients, and you have real responsibility for those patients. They're your patients. Our curriculum has 7 clerkships as well as 2 electives, and we've broken that down into 3 super blocks. And each super block has a group of clerkships that go with it. So you can see here, first is internal medicine, psychiatry, neurology. The next one is surgery, obstetrics and gynecology, and an elective. And this one here is pediatrics, primary care, and an elective. You can start in any super block, and you can start anywhere in each super block. But once you're in a super block, you're going to take everything in it before you pass over to the next super block. And so you would start, let's say you start with obstetrics and gynecology, then you do an elective, then you do surgery, and then the next one you would say you start with primary care, do an elective, and then pediatrics. You could see that each super block ends with an OSCE exam. This is a clinical exam where standardized patients, that is actors posing as patients, are going to test you on how well you clinically reason, examine, etc., and how your clinical skills are. There is a part of your exam for licensing. It's called USMLE Step 2, Clinical Skills, or CS, which simulates this much the same, and we want to make sure that you are prepared for that as well. So not only do you get these OSCEs at the end of your super blocks, you also get them sporadically throughout each block in your M1 and M2 years. So we will have you very well prepared for this as well. Your 4th year has a few requirements in it. Your emergency medicine clerkship, a sub-internship where you act as a junior intern, where you actually have a lot more responsibility, and it usually occurs in one of 4 specialties: medicine, pediatrics, family medicine, or surgery. And then the clinical bridge course at the end, which is a boot camp that prepares you for actual internship. The rest of the year, you're going to prepare to take step 2, both the clinical skills portion, which is that simulated patient portion, as well as the clinical knowledge portion, which is another knowledge part of the licensing exam. There is a step 3, and that one you take during your internship. You usually do not take that during medical school. And the rest of the time is spent taking electives, exploring different areas of medicine that you have an interest in or that you feel you want to pursue further, and interviewing so that you can start getting into a residency. And that's it. That is our curriculum in a nutshell. If you have any questions, please feel free to contact me. You can email me or just stop and talk to me, and I would be happy to answer your questions. You can also email Princess Currents. She's our Director of Curriculum, and she can also help answer questions for you as well. I wanted to wish you all good luck and wish you all the best, and thank you for watching.